is both an honor and a pleasure to introduce to you our first speaker for this morning. Dr. Lechner has studied dental medicine in Munich, Germany since 1980 with main emphasis on complementary dental medicine. He studied the diagnostics of active regulation, testing for odontogenic disturbance fields, focus renovations, and biological compatibility. In 1998, Dr. Lechner co-developed the new CAD/CAM technology to mill the biocompatible material zirconium oxide and research on other metal-free dental materials. He served as a board member of several medical associations of integrative medicine. He has lectured extensively and published several articles and books in Germany and abroad. He developed 3 different software programs for the testing with kinesiology and scalar waves. Please give a warm welcome to Dr. Johann Lechner.
I read the disclaimer first. I do not have any financial interest of a product in my talk or with any companies offering grant monies for this continuing dental and medical education program. Now, good morning, everybody. Before I start, I want to emphasize how grateful I am to Rich Fisher that he gave me the opportunity to speak here and to bring back some of the knowledge I got from holistic doctors, scientists, and dentists in the United States, especially from Professor Jerry Bucco and Professor Boyd Haley. Now, the subject of my speech is chronic osteonecrosis of jawbone, Nico. Is Nico an unknown trigger for systemic disease? This is a picture from Munich, the town where I come from. I have the choice between the cathedral and a picture of the Oktoberfest, but I did the cathedral. Now, what is Nico? This is a wonderful picture from Professor Bucco. And you see the cavitations, that means the hollow spaces in the jawbone. What can we find inside the jawbone? We found fatty, degenerative marrow and spongial bone. It's totally soft, it's yellow, it's fatty, degenerated. And it contains fat cells. Now, the question is, why is Nico such an unknown subject in dentistry? Here you see a picture of my clinic. This is a patient who already got an appointment in the heart clinic in Munich University Heart Clinic to get a pacemaker, implant of a pacemaker because of her heart arrhythmias. The X-ray is totally unconspicuous. But when you open the cortical bone and you can curate and you can take out this soft, fatty, degenerative spongial bone in such an extent, going down to the mandibular nerve, going back far up to this retromolar area. And it's not drilling out healthy bone, it's just taking out soft necrotic tissue. And this patient, some days after this surgery, canceled the appointment for the pacemaker because the heart arrhythmia was gone. Now the question is, what do dental X-rays show anyway about jawbone? This is the retromolar area of a patient. He is 46 years old and suffers from morbus Bechterew. You know, his backbone is totally stiff. It's a rheumatic disease. And again, this area, there is no reason to do a surgical intervention. If you do it anyway, and you take this soft Nico tissue and bring it to the lab, and let the lab check for the heavy metals inside this soft tissue, you find indium is 1,450-fold increased. This is in microgram of kilogram body weight. Palladium is increased 9,921-fold, and silver, the contents of silver in the soft degenerated Nico tissue is increased 78,000-fold higher than the threshold. But this X-ray never gives you the idea of this dramatically elevated heavy metal contents. This is another case, a young lady suffering from migraine. This is her titanium implant. We took the titanium implant out. We had reasons for that. But what I want to show you is, here you see the screw from this implant, and you see these black spots. And these black spots is titanium. So titanium is not as stable as we believe, as we think. When we send the bone, including these black spots, also to the lab, the spectrography shows titanium, we have 50,600, and it should be below 1,000. So we have 50-fold the contents in the contanium in the surrounding jawbone. This is another patient, also titanium implant. This is a patient who developed Parkinson's disease a few months after getting this implant. The X-ray shows a little here. It's a hyperdensity. And this is the cavitat. I think you know this cavitat machine we got from the United States. And you see the bone around this titanium implant is infected and soft. It is not as dense as it should be. Now, when we look at the bone surrounding this titanium implant, you see first these black spots. What is this? This is again titanium. And you see this yellowish colored spongal bone, which is typical for the fatty degenerative Nico area. So we have, in this patient, around this titanium implant, we have titanium particles in the bone, and we have this fatty degenerative Nico tissue. When you look through the microscope, you see wonderful these metallic titanium particles in the bone. Now, there is one interesting research published in Journal of Bone, Joint and Surgery. The tumor necrosis alpha is activated by the allergic response to titanium. The results of this research is the exposure of macrophages to titanium alloy particles in vitro for 48 hours. These patients have their titanium implant should they have for a lifetime, resulted in a 40-fold increase in the release of TNF-alpha and a 7-fold increase in the release of interleukin-6. We know that TNF-alpha is not very good for your health, and the increased level of interleukin-6 isn't either. But this, I show you this research because this research gave me the idea to look for Nico samples for immune messengers and inflammatory cytokines in Nico samples. So the guiding question of the presented research was, does Nico also contain inflammatory immune messengers? And can these immune messengers in Nico possibly be related to silent inflammation or systemic diseases. This is another picture. I filled in a contrast medium to show the dramatic extent Nico lesions, not regularly, but very often have. And these are these Nico samples, the soft, fatty degenerated tissue we take out from these Nico areas. And we send these Nico probes, we send to a special lab in Munich, and they check the Nico probes for 27 different cytokines. This research was already published in the journal, in the European Journal of Integrative Medicine, was accepted. You can find it under science.com. So this is science. And what is the outcome? We go over that. In all these six Nico samples, one immune messenger was really high. And the name of this immune messenger is Rantes. Or the new modern name is Ccl5. But let's stay with Rantes. So now, I just looked at the internet, in the scientific literature, what can Rantes do? Where can we find Rantes? And this was especially, excuse me, yeah. And these six samples gave us the energy to check another 11 ones. So altogether now we have 17 Nico samples, and in all 17 Nico samples, Rantes is high. Now, the question is, can this Rantes levels in Nico lesions contribute to problems in organs or biological systems? Or, if this is the case, or can we, vice versa, by cleaning these leukocytes, reduce the inflammatory signaling by Rantes originated by the Nico lesions? And can we thus get a therapeutic salutogenetic effect? Now, here is Nico, and here we have the high Rantes levels in Nico. Now, where could be the connections between Nico, Rantes, and certain diseases? You find Rantes, this is all what I say now is all citations from scientific literature. Rantes we find very high if the signaling in the endothelium of the vessels is bad, and science knows Rantes is thus connected to cardiovascular diseases. Rantes is very high in joints of patients with rheumatic arthritis. Rantes is very high in the central nervous system with MS patients, Parkinson patients, and astrocytomas also contain a high level of Rantes. Rantes is the signal on which mast cells produce or release high levels of histamine. So Rantes is connected to any sort of allergies. Rantes is responsible for alopecia areata, loss of hair. And Rantes is connected to diseases of the thyroid. But most interesting is the connection between Rantes and tumors. Rantes plays a role in morbus Hodgkin. I will refer in details to this later. Rantes is high in the serum and in the tissue of breast cancer patients, and Rantes is that signal that provokes breast cancer cells for metastasis. This is amazing. Now, This is the high Rantes level. And we also have high levels, not that high, of FGF2, fibroblast, growth factor, and of MCP1. This is a monocyte chemoattractant protein. What does FGF2 and MCP1 eventually do to the body when it's high? FGF2 is also found in vessels at cardiovascular diseases, plays a role in rheumatic arthritis, here and there, and plays a role in the development of tumors, here Rantes and here FGF2. MCP1 plays a role in depression, and MCP1 plays a role as a signaling substance in diabetes. So it's amazing how many connections we get from Nico, the elevated immune messengers in Nico, and systemic diseases. So this is just an example. A patient, age 38, pain in knee joints for 12 months. He couldn't get up in the morning, 38 years old. Diagnosis was this. This was the orthopedic therapy. We did one Nico surgery, and then the patient is writing the following letter. That means he lost his pains in the knee after cleaning the Nico. Now we know how could this happen. Eventually, we erased the inflammatory signaling through Rantes, by cleaning the Nico site. And so in the joints, the inflammatory situation was reduced very quickly, and he was cured from his arthritis, this was the orthopedic diagnosis, by the Nico cleaning. So this is the hypothetical causal relationship between the Rantes secretion in Nico and the joint problems. And the funny thing is, science knows about this. This is a research published in the Journal of Biological Chemistry, expression of the cytokine Rantes in human rheumatoid synovial fibroblasts. Yeah? But science knows what Rantes can do, but nobody is aware that a consistent source of this Rantes signaling eventually is in your Nico sites in the jaws. And this might be for 10 years, for 20 years, and for 30 years, and nothing happens. But suddenly you get a specific individual setup, and the arthritis comes up. Now, Nico, Rantes, and its hypothetical role in multiple sclerosis. These are citations from here, primary sensory neurons migrate and so on, Journal of Neuroimmunology. Rantes CSF levels were elevated in MS patients. CNS expression of Rantes in MS brain was shown to predominate at the edge of active plaques. Rantes could be a pro-inflammatory key substance in the pathogenesis of MS. This is not the commitment of an holistic dentist. This is science. So, our integrative hypothesis is Nico Rantes enhances the inflammatory response in the central nervous system. Now, another example, Rantes and the hypothetic role in breast cancer metastasis. With the aid of messengers, and this is Rantes, transmute tumor cells into metastasizing cells. And now it's becoming very interesting for holistic dentists. This is saying these guys here, this enhanced metastatic ability is reversible and is dependent on Ccl5, is Rantes signaling. What does this mean? This eventually means in case a woman suffers from breast cancer and we get the chance to clean mucocytes before the metastasis starts, because you know the metastasis is the problem, not the primary tumor, before the metastasis starts, we eventually can help this woman because we arise this signaling. I never would say Rantes is the cause for breast cancer. Yeah, this would be not appropriate. So, again, in details, in Germany, one out of 10 women gets breast cancer. Every year, 57,000 women are diagnosed with increasing tendency. These are official data in Germany. So, increasing tendency means medicine doesn't know where it comes from, really. So, back to dentistry. This is a patient and her breast cancer was operated in 2009. After that we got her. And look at this area here. This is a wisdom tooth, upper left wisdom tooth. This is the area, we call it retromolar area or area number 9, because the wisdom tooth in European counting is number 8. This is number 9. And if you know what Nico is, you can presume that here is soft, fatty, degenerated, spongial bone. The capital shows. Now, when we check this Nico area of this patient, especially for its Rantes contents, we see Rantes is very high in this area. So here we have, in this case, we have a connection between the breast cancer, which is there, and the high Rantes level inside her Nico area. These are just citations from here clinical cancer research. This is also cancer research. Rantes content was markedly elevated in all patients with breast cancer or cervical cancer. The Rantes content was markedly increased in clinical normal tissue taken from near the operative site several months post-operatively. This study suggests an as yet undefined but important role played by Rantes in the carcinogenesis. Or that expression of Rantes in breast tumor cells is elevated significantly. Our results suggest that breast tumor cell-derived Rantes might promote breast cancer progression. This is science. Or breast cancer cells stimulate secretion of Rantes from mesenchymal stem cells to enhance their motility, invasion, and metastasis. The bad boy about breast cancer is Rantes. And in every single of these 17 Nico samples we checked, we have high Rantes. And this is a good address here, Nature. Rantes showed a significant increase in breast cancer cases with no metastasis, and it showed a highly significant increase in metastatic patients compared to controls. I think this is a shocking connection between this totally unknown Nico thing in your jawbone and an increasingly growing form of cancer. This is another patient, she's 49. Hodgkin disease was diagnosed with her in 1976, Multiple sclerosis diagnosis was done in 2005 on her. Breast cancer operation was done in 2006. And now, this is the X-ray. All other dentists before said, there is nothing. This wisdom tooth area is totally all right. When we check with cavitat, this is completely different. Cavitat shows the softened bone. And now, when you check for the contents of Rantes in this wisdom tooth area, this is number 3839 in European counting, Rantes is extremely high in this Nico area. And what's her story, medical history? Hodgkin, MS, breast cancer. Now, could it be that we have one source, one signal, the source is the Nico, the signal is the Rantes, and this Rantes here made her develop a Hodgkin disease, because, this is the scientific citation, results suggest that Rantes produced the HRS, these are the Reed-Sternberg cells, which are the Melan cells inside molars Hodgkin, produced by HRS cells, is one mechanism by which mast cells can be attracted into the tumor. Then, the Rantes signaling went on, and in 2001, she developed MS. Rantes CSF levels were elevated in MS patients compared with controls. Journal of Neuroimmunology. Rantes could be a pro-inflammatory key substance in the pathogenesis of multiple sclerosis. Journal of Immunology. And still nobody cares about the Rantes, the source of Rantes. So in 2006 she developed breast cancer. Because breast cancer cells stimulate de novo secretion of Rantes and so on, invasion and metastasis. This enhanced metastatic ability is reversible and dependent on Rantes signaling. So the question comes up, is this one patient, one immune signal, the Rantes, but three different diseases? This is just an idea, a hypothesis, but it's an impressive coincidence in this case. Now there's another case, interesting case. This is a 19-year-old woman, 19-year-old young woman, yeah, okay. And she is losing her consciousness 1 to 5 times a day. That means she just falls over, is lying for 5 minutes at the floor, then she wakes up again, stands up again, and everything is okay. But she's 19 years old. She's not allowed to drive a car. She cannot go alone to school. It's everyday traffic is very dangerous for her. So this is her letter. The first time I lost my consciousness was between the removal of 4 wisdom teeth, and that's very interesting. She was totally healthy until they took all 4 wisdom teeth out, gave her antibiotics for 1 week, and that was it. So the wisdom tooth issue was done for the rest of the life. She was for 1 year in an Austrian university clinic, and they didn't know what to do with her. They gave her hormones, with 19 years, of course. They gave her effectine, which is a serotonin uptake inhibitor, but nothing was able to improve the situation. At the end, she was a psychiatric case. After 1 year of totally fruitless therapy. For more than 1 year, it was quite normal to lose consciousness up to 5 times a day and not to be able to leave home by myself. It was 19 years. And this is her X-ray. And look at these wisdom tooth areas. Look quite nice. Look at this root filling. Looks quite nice, doesn't it? But does the X-ray actually show what's going on inside the bone? This is the cavitat from this area. This is number 7, and area number 7. This is the area 8 and 9. Cavitat shows softened bone. This is and just an example, sort of how, if you take off the cortical bone, how soft the spongial bone is underneath. And this is her report. Here she got the wisdom tooth operation, and immediately after that, these, we call it syncopes. Thank you. The syncopes started. And in October 2009, in this month, she had 55 syncopes. 55 times in this month, she fell over and lost her consciousness. And this was the first operation we did in the left lower. Then these attacks went down, went up again, because we had to redo this surgery. The wound was not healing properly, and it went down. We did wisdom tooth area number 2, and no attacks in September, October, November 2010. Then she came up again, and we cleaned the next wisdom tooth area, and now she's totally cured. It was just the wisdom tooth area. This is another case. Yeah. This is another case. You know, Nico means, this is the definition from Professor Bucco. Nico means neuralgia inducing cavitational osteonecrosis. So I want to present you a case with facial pain. Look at the X-ray, it's okay. Look at the cavitat, it's not okay. This is the MRT they made, and the radiologist that the MRT is totally unconspicuous, no signs for inflammatory osteonecrosis in the jawbone. And this is when we opened the cortical bone, when we curated the soft spongial bone, the marrow, the fatty degenerated marrow, and here you see the nerve, the mandibular nerve, the nervus infraalveolaris, at a length of 2 to 3 centimeters, totally naked, totally derived from its bony sheath. This is what you can see at Cherry Bucco's pictures, but this is the living substrate for that. And of course, the neuralgia was gone. 3 months later, we checked for bone density, and we inserted 4 ceramic implants. You get the company next door. And we inserted these ceramic implants. I want to show that to the dentists amongst us, this case, because Nico cleaning does not mean you ruin the patient's bite. Yeah? Of course you have to restore it afterwards, but this is wonderful possible with these metal-free ceramic implants. Now, to make a short summary, Nico does exist. In spite of its diagnostic difficulties, that's the problem. There are many things out there we do not see. Nico produces inflammatory immune messengers. In this lecture now, I concentrated on the Rantes, but there are, showed you there are a few others which are also interesting. Nico can be a trigger for systemic disease by this consistent inflammatory signaling through Rantes, and Nico surgery is of little known salutogenetic value. When we refer to the breast cancer cases, it eventually could be, it could prevent the metastasis of breast cancers. So thank you very much for your attention. As I have to leave at 3 o'clock in the afternoon to get my plane to Chicago and from there back to Munich, we decided to accept 5 questions and to answer 5 questions.
Concerning the implants that you use, you'll see the ceramic implants in the slide. Some of us have been thinking that it's the actual penetration of the mucosa that leads to some of the issues with implants, and that implant cases show up poorly on cavitat scan because not necessarily the metal of the inflammatory action of the titanium, but just simply the penetration of the mucosa. What can you say about that?
Well, let me do it very short because this is not basically the subject. But also the mucosa and the soft tissue lies wonderful to this zirconium substance. If you take out gold crowns, put in ceramic crowns, you never have to do, in most cases, you never have to do periodontal treatment. It's gone.
Would it be reasonable to screen people for serum levels of Rantes?
Yeah, but the thing is, medicine knows it. You know, to screen breast cancer patients for Rantes, okay, you can do it, but it's of academic interest because we know breast cancer patients have elevated Rantes levels in the serum.
No, I mean using it as a screen on patients who are not identified as cancer is just part of routine health screening.
Yeah. In advance, you think.
Right.
Excuse me, I didn't pick it up. Eventually, yes. Yeah.
Yes, as I know, ozone is very widely used in Germany. I was wondering, have you seen the effect of ozone on Nico lesions as well as the effect on Rantes?
I didn't do research about that. I think I'm dealing with ozone for 30 years and I love ozone. But big Nico lesions, you have to do the surgery. Yeah. In smaller ones, eventually, you come to good results by ozone injection. Why not? But I didn't do the research, but it's a good idea. Thank you.
In your clinic, have you done an analysis of the anaerobes that are also in these lesions?
No, but I refer to the publications of Lechner and Jerry Bucco and so on. I think we have a lot of literature about that, and we know that there are anaerobes, and we know from Boyd Healy that these anaerobes produce sulfur hydrogen toxins and are very toxic. This is another aspect, the toxic aspect. I wanted to show you we have heavy metals. You know about Boyd Healy's publications about toxins. And the new aspect is the Rantes. Of course, we also have interference to the body by meridians. You know this? You know the schemes from Dr. Fall and Dr. Kramer. Of course, there are so many levels in which Nico can work dramatically.
I'm a general dentist in Indianapolis, and I've had a number of patients who've had Nico, my brother and I both. And one of the issues that I've had, a couple of issues, is that first of all, a lot of dentists don't even believe in Nico. I've talked to Jeffrey Okeson, for instance, who doesn't even believe in it. The other problem is, where do you get a cavitat? How do you evaluate patients? Because I've never even heard of cavitat until I came to this meeting today. And one of the issues that we do have a group of dentists in Indianapolis who do treat Nico, and I've seen the surgery, but the problem that they have also is determining from x-rays, which are a poor modality, how do you get to the cavitat? Who has it?
Well, I was afraid of this question because Bob Jones, the former owner of Cavitat, he closed down his shop. And I just use here Cavitat to show what's actually going on in the bone. If you do cone beam radiology, and I look forward to the next speaker about the cone beam radiology, and if you're familiar with it, you can do a proper interpretation of the X-ray situation. But if you're not familiar with Nico, you will say there is nothing. And of course, many dentists still believe in the non-toxicity of amalgam. So they believe a lot. We don't want to be the believers. We try to deliver scientific data.
Often discussions of what problems cavitations cause also say that toxic infected root canal tooth causes many of the same problems. Is there an association between Rantes and a toxic, badly infected root canal tooth?
Well, I would say if you have really a bad root canal, you have underneath, periapically, you have Nico, and then you probably have Rantes.
Next. What we've been using more the last 35 years is Dr. Bohl's technique with the electrodermal screening for finding these cavitations, and then checking post-operatively with the electrodermal screening. It seems to be quite successful. I don't have the data that you have, but I've been sending my biopsies to Dr. Bucco for analysis, and that seems to work quite well for the patient.
Mm-hmm. Well, let me say, I knew Dr. Voll personally because I'm doing this we call it electroacupuncture for 35 years now. We changed a little to a specific way of kinesiology because we have no clinical way to find out you have Nico, but which organ is connected to this Nico lesion by Rantes? Yeah? Is it the lymphatic system? Is it your central nervous system, or is it your liver? We need tests like Dr. Voll developed. Yeah.
Do you have a discriminatory test between a safe and an unsafe root canal treated tooth?
Yeah, very quite simple. We have the Topaz test.
That's no longer available.
Okay. For us, the cavitat around the periapical area is a guiding thing, you know. And we always make these, we call it DVT, digital volume tomography, what you call cone beam radiography, and we use this permanently.
There will be a speaker on that this afternoon. Good. Thank you very much.
Thank you. Okay. Thank you very much for your attention.